I'm Dr. Mark Valente. I'm an orthopedic spinal surgeon in the Dallas-Fort Worth Metroplex. I grew up in the state of Michigan. I went to the University of Michigan for undergrad. I then went to medical school in Florida and did my orthopedic surgery training back in Michigan through Michigan State. And then I went to do spine surgery fellowship at the University of California in San Diego, where I had a special emphasis on deformity, complex revision surgery, and minimally invasive spinal surgery. I then came to the Dallas-Fort Worth Metroplex, where I've been in private practice for over 7 years, and I'm proud to say that I'm in the cutting edge of spinal surgery with a special emphasis on minimally invasive surgery. I spent a greater part of my training traveling around the United States, going to leading institutions where I got significant in-depth training on a multitude of minimally invasive and advanced techniques that are pretty rare in our field. So I pulled all of those little tricks of the trade, so to speak, and special techniques into my armamentarium to help treat each patient individually. So I chose to become a physician when I was probably about 14 years of age. I remember specifically sitting in my family room, and my parents were having a discussion with my older sister, who was in college at the time, and they went over different career options for her. And I was sort of just in the other room, kind of listening in, and they started to talk about medicine as a career option and the pros and cons to medicine. And it was at that time that I really realized that through medicine I could satisfy my thirst for science and for helping people at the same time. So it's at that moment, sitting there, that I said, this is what I'm going to do. I know it's going to be a long, hard road, but this, I think, can be my passion, and it has become my passion. I think some of the procedures that I do are very unique in the spinal surgery world. Some of the minimally invasive techniques are pretty rare, and they take a lot of training and skill and time to learn and develop, operating through small tubes in order to prevent tissue damage and ligament and tendon damage. But to get the job done effectively is technically quite challenging. And so it's through many years and many surgeries that we've been able to perfect our technique. I think that the minimally invasive surgeries that we do are extremely cutting edge, and I'm proud to help patients through those techniques. My patient philosophy is treat everybody like they were my mother, father, brother, sister, wife, child. And I also believe that it's really up to the patient most times to decide what the best treatment is for them. It's their body, they know it best, and they know what their quality of life is like, or how poor their quality of life is. I feel that it's my job to educate my patients, to inform them of, number one, what their problem is, what the diagnosis is accurately, and to help guide them to reasonable treatment options. The most common concern that patients have when they come into my office are concerned that they might lose motion. I've done thousands of back surgeries and neck surgeries, and I can tell you that it is extremely rare for somebody to say after a surgery that they're doing great, they have less pain, it's just they feel like they have less motion. The reason why is because if somebody has a bad disc, say, for example, and they have pain from it, then the pain is stopping them from using their good disc. If we get rid of the bad disc, now they can use their good discs again. So in fact, many patients come back after these surgeries and say, you know what, I actually feel like I can move better than I did before surgery. So one patient experience and story comes to mind. This gentleman was 45 years old. He had 3 small children and a wife, and he was rapidly declining. He wasn't able to work for the last month. His balance became off. He was dragging his foot, and when he came into my office, he was in a wheelchair. He had severe compression of his nerves and spinal cord, and it was basically an emergency situation. We were able to take the pressure off his nerves and spinal cord. He spent a night in the hospital, and he walked the next day. And to see his children and his wife cry because they were so happy for their father brought tears to my eyes as well. and it's really why I went into medicine. I think the most important thing for patients to know about me is that I really believe that each person should be treated as an individual, and that it's my job to help them make decisions and be informed. And from there, I really try to treat everybody the same and everybody like they were my family member. The reason why I enjoy working with North American Spine so much is because the patient care is superb. I know that when my patients are being taken care of by the North American Spine family, that they are getting the utmost attention and the responsiveness is spot on. And when I have a happy patient, I'm a happy doctor.